It's not difficult to set up. I appreciate it is quite time consuming initially to set them up, but if we start small and just as new patients come along that are identified in that last 12 months, maybe identified at your GSF meetings, if you're having those, having that discussion with the family, is it okay to share this information? It will help if you do have to call the out-of-hours service or any other clinician. If you have to go into hospital, it'll help because they'll have that information. It's worth spending the time just setting them up as they come along, maybe. But that'll make a big difference to your care in the future. And it'll make a difference to the practice because actually, in the long term, your patients are going to be better off for it. And as you go down the line of setting them up as patients are coming along, before long you'll have lots of patients with an EPaCCS and it isn't going to be an onerous job.
So GPs may be the person to create an EPaCCS record for a patient, but other members of the health care environment can also do that. For GPs, the preferred way was creating and accessing EPaCCS records is via a single sign-on process through your clinical system. So this minimises having to input all the passwords, etc. It just goes in through the system you logged into with your NHS smart card. What is encouraged, however, is that other people who are involved in that patient's care can create and edit EPaCCS records where appropriate permissions have been given. So, for example, district nurses may be the best person to create a record, or hospice specialist nurses, or palliative care staff either in a hospice or hospital environment. So, in essence, any member of the team looking after that patient can create that record if that's been enabled within their local IT functionality.